Hi, everybody. So we're going to be doing a live webinar that starts towards the end of January and goes 8 weeks into mid-March. And I'm just going to be, I'm just working on upgrading the Enhancing Sexual Intimacy course. It may become its own course because it's going to be linked to the book. So it's going to have something to do with both sexuality and spirituality and intimacy. So I have a few weeks to still figure out exactly the scope, but it's really about how to have a richer, deeper sexual relationship. And so that is a live webinar. That means I will be teaching. We'll have one session per week. You can ask questions. So it's a nice way to have more of that interpersonal experience with me, but not have to travel and, get sitters for the kids and that kind of thing. And the nice thing about these, I actually hope we will do more of these once I have some other projects off my plate. But the thing that's nice about them, I think, is it gives you a little more time to process, and there's a time to be there for the next session. So, you can do the assignment, you can be thinking about those topics, talking about them as a couple, working on whatever assignments there are, then coming back for the next step in the process. So, Chrissy, where should people find information about the webinar?
I will grab the link and send it out. I also sent it out in an email today, but the cost to participate was $5.95 for the 8 weeks, and that's for you and your spouse. Recordings are available if you aren't able to make it to a session. And I really do think the webinars are just one. I mean, I love all the ways to learn from you, but it's a great price point for being able to ask live questions and to hear your new content and new thinking. I think the webinars are really great. And we have a group chat going along that people keep the conversation going throughout the week as well.
Yeah, great. Yeah, that's right. That's a nice resource too, just being able to talk to each other and ask, how did you make sense of this and so on. And it's a relatively small group. I mean, it's not small. I can't remember. I think, I don't know that we have a upper limit, but it tends to be between 40 and 50 couples. And so it's not a huge group. Okay. All right. So we're going to talk about men and low desire. And I'm going to pull up my document here. Second. So this person just writes this question, and I think it's a good question just to launch with and to start with. But he says, how can I be honest with myself about where my lower desire comes from? How can I really know if it's a mental state, medication related, or even biological? So I just would say in general, starting with the doctor is always a good idea because our biology is always the basis on which our sexuality is established. And so you need your biology to be working in your favor. If you're sick, if you're on medication, if you're having high blood pressure, heart disease, just things like that, they can all affect sexual functioning and desire. So it's just a good idea. I say this to women all the time too. If you're struggling with, anorgasmia, or you're having painful intercourse, it's just always a good idea to go to a specialist in sexual functioning, a urologist if you're male, that has a specialty in sexual functioning, because they can just rule out or help you better understand if there's something going on that needs to be addressed at the biological level or the medication level of medication. But then the meaning that we make about sex is very, very impactful and really does shape our sexual functioning. So if your biology is functioning well, then it's really what meanings am I making about sex and how are they impacting desire, arousal, orgasm? Because the meaning, as we say, the brain is the most important sex organ. The meaning you make has high impact on your sexual functioning. And so sometimes we say things like men are sexual machines. And, it is true that men are more likely to get turned on in this almost what seems just like reflexive way by attractive body parts, and at least more than women do, right? Women are a little more, just aren't as likely to kind of feel spontaneous arousal as men experience. But just like women, for men, the meanings around sex are still a big deal, especially in a long-term relationship. Um, when you're newly in a relationship, there's so much positive feeling and positive emotion that sexual arousal and desire and so on can be very easy. But then once you move into the relationship and it gets more established, then often there are meanings that emerge, and this is entirely what my Enhancing Sexual Intimacy course is about, is that there are meanings that emerge that start to interfere with desire. And so men are just like women. These meanings matter. Women want, in general, when we think about sort of the masculine feminine dance and how alive it is in seduction, in sexual arousal and desire, women, generally speaking, want to feel desirable. They want to feel desired. They want to know that they turn you on, right? But men, they want to feel welcomed. They want to feel received. Esther Perel talked about this recently, but she's basing it on some research that was done somewhere in Chicago. I can't remember what institution did this research, but they were just looking at the arousal patterns of men and women. And the way that they explain this is that, women don't want to feel like they need to take care of a man. Like women are socialized into the idea of being a caretaker, a nurturer, and in sex, they don't want to have any of those social roles. They don't want to be taking care of his feelings. They don't want to be, being maternal towards him. They want to be the turn on. They want to know that I get you going and that I'm not attractive and I can surrender into that position. I don't have to caretake anyone. But the reciprocal side for men are taught to be protectors. And but in sex, if you feel like you're an intrusion, that you're not welcomed, right? It's going against the social role to proceed. And so men that are sensitive or kind or good, like they don't want to basically intrude where they're not welcomed. And so the turn on is to know she is turned on by you. The turn on is to know that she wants you to be there. If you look at porn and so on, these are always like very welcoming smiles, like, I'm happy you're here. I want you. And so men also are very attuned to the meanings and specifically, am I welcomed? Am I desired? Am I wanted? Now, many men can still have sex, even if they don't feel welcomed or desired, but you're going to have a lot more sexual dysfunction happening if that meaning is there. If you feel critiqued, if you feel that you're in imposition, if you feel that she doesn't really want you to be there, you're going to be more likely to orgasm more quickly than you want because that anxiety adds to the overall stimulation. You may struggle you may have erectile dysfunction because of the meaning. And so, and then there's, of course, many men who they just avoid it altogether. I don't want the judgment. I don't want the rejection. I don't want the uncertainty of the meaning around sex. And so it's easier to either shut it off entirely or to express sexuality in places that feel safer. Masturbation, pornography, just taking it out of the vulnerability of a relationship. And so, yeah, and I think especially for men who grew up in an environment where there was a lot of critique, especially maternal critique or female critique, uh, they can often believe, I see this in clients of mine, if they had a mother they felt like that was either critical of them and or a mother they felt like they had to take care of her feelings, they grow up and often marry someone they feel like they have to take care of their wife's feelings. That the wife is connected to a sense of having a job to do. I'm supposed to make her happy, and she's never happy with me. And again, if you have this sense I'm not welcomed, or I feel a sense of futility, I don't feel masculine and strong. I feel like um, I have a job to do here that I never succeed at. That can just make it really easy. These are men that can be completely sexual have sexual feelings, even want to be able to initiate sex with their spouse when they get home from work. But then they get into that environment and they feel or fear the critique and they just don't want to take the risk of it. It's also, I think, another way of thinking about it. This is just one of the meanings that I see as a kind of common pattern is that especially if you spend a lot of your energy trying to make your wife happy, or you at least see yourself that way. She may not see you that way, but you see yourself as like trying all the time to just kind of do what she wants you to do, manage what she wants you to manage, the nice guy kind of thing. Then there can be a resentment, like, I don't want to give you everything. Why do you get to have everything? Like I do all these other things for you. You don't appreciate them. And I just don't want to make love to you also. And so I think the question, this is just a way of getting at this larger point, is what are the meanings that are happening that I find undesirable? So again, you can be a fully sexual person, but the meanings in your marriage are making desire feel like a burden, making sex feel like a vulnerable place to be. And so you just tend to avoid it rather than taking the risk of that exposure, or you don't want to really give in that realm. And so you just avoid it instead. And so, a good therapist, or even just deeper self-reflection to start getting at what is it that I'm trying to get away from. Okay, so this person writes, if a low desire or hesitation stems from occasional erectile dysfunction, what are non-prescription ways to improve erectile function, especially after age 50? In addition to Kegel exercises. If mental and emotional factors play a role, how can that be improved? So yes, so first of all, as men start to get older, they become more and more likely to have at least occasional erectile dysfunction. And this has a lot to do with just overall cardiovascular health, because erections are connected to that cardiovascular um, flow. And so as men get older, their bodies are less responsive. And what ED medication does is, like Viagra, or I can't say the other one right now, Cialis. I can't say that name, it's not in my head right now, but basically there are two different approaches to basically, in a short term way, making an erection more likely. So if you don't want to go the medication route, then you just have to do anything that can strengthen your cardiovascular health. So exercise, eating healthfully, those are just physical things that are going to make erectile dysfunction less likely. But in the mental space of it is, how does one respond or react when your phallus is not doing what you want it to do? Because, men are valued often, and perhaps unfairly, right, by what they do, much more than women are. And in the masculine feminine dynamic of a heterosexual relationship, it's often the man is the doer in bed, the seducer, the one who's more active, and she's surrendering into that sort of sexual care, right? The sexual pleasuring. And so if he feels like, his phallus, he doesn't have the tools in the toolbox, it's not working that way, it can be, a man can start to then stress about that. Like, oh my gosh, like now's our chance. And what if I don't what if I don't have an erection? What if my body disappoints me? And that worrying in and of itself can have downward pressure on the likelihood. That is, when you get anxious and stressed, you are less likely to get aroused. Um, you know, our sexuality doesn't like to be bossed around. Phallus doesn't like to be bossed around. It wants to be. It wants freedom. Sexuality wants freedom. And when we're judging and critiquing and fretting, then our arousal tends to go down. And then what often happens is, not only do you have your own anxiety, But then your spouse can think like, what's happening? Why is he not attracted to me? Like, obviously, his penis is giving him away. Like, obviously, something's going on. And then the man can feel his wife's stress about that and can feel that that's anti-erotic for her, which then can increase his stress, which it makes then arousal even less likely, which makes her maybe even more suspicious about, is he, not into me? Is he looking at porn? Is there something, is there someone else? All those kinds of meanings. And so those things happen um, pretty easily unless you're really able as a couple to settle yourselves down and be patient with your bodies. And especially as you age, you need more and more patience and to not take things too personally, because that is an anti-aphrodisiac if you are projecting a lot of meaning onto the body. So the more you can just settle down and understand there's a lot of ways to have pleasure, even if my body doesn't cooperate, we can still be together, even if it doesn't come along for the party. Then you're much more likely to not be adding that added layer of anxiety that's going to interfere, and your body's probably more likely to respond just more slowly than normal. All that said, I do think it can be very helpful for people to just have, if a woman's, for example, afraid she's going to have pain with intercourse and she just needs extra lubrication, it's a similar kind of thing, Viagra. It's like, it's just a way of, like, because what can happen is if a woman's afraid of it and she's afraid it's going to be painful and then she's more anxious and she's less aroused, then the likelihood goes up that it's going to be painful. Where if she can do something that basically makes her not be worried about that, then, it all goes in the right direction. And so Viagra or or the other one can be very useful in this way of just taking that anxiety away. But you know, as people get older and older, then it becomes more likely, more valuable. When you're in your 50s, I mean, it depends on who you are and how your body works. You can still do a lot through just good exercise and good health and a little patience. And there may be a point at which you decide that, taking medication is a better way to do this. Okay. This person writes, my relationship was considered good, but now it's great. I was definitely the higher desire person, very high, and rarely did my advances get rejected. If I was rejected, I would be a bit pouty. I had nice guy tendencies, but I wouldn't say extreme. After taking JFF courses and consuming all the JFF podcasts, I learned more about my faults and being a better man and partner. What I find intriguing, is while I am still the higher desire person, my drive and hunger for sex is almost non-existent, or maybe more accurately, nothing like before. Like I am less of a high desire person, although I'm still the high desire partner. I have far less random erections, far less urges for sex. I'll try to put it another way. It feels like less biology and more relational. Yeah, I'm curious how old this person is. We have a lot more eros energy and ravishment. Part of me thinks I need to see a doctor, or maybe it's getting a little older, but there's zero problems when we have sex. Is this type of change normal and expected when operating from a different frame and meaning? Could you speak to the experience I'm having? Thanks for all you do. Okay. Well, so let's see, there's two different possibilities here. So just in terms of aging, one of the things is that I think this is research by Barry McCarthy. I know that he cited it anyway when I was doing a training with him, where basically the people I'm not saying that this is this person, but the people most likely to shut down sex after 60 are men, not women. And that is because, as I was just speaking about in the last question, if your body starts to become less predictable, right? Or you're not certain your body's going to respond, that can feel exposing and humiliating. And that is to say that as men age, they just are, an 18-year-old is going to feel arousal kind of all the time, whether or not they want to, think they should. The biology is driving it more than ever. And as you get older, that becomes less and less the case. And it often opens up for some of the most meaningful sex in the second half of life, because the biology is not as pressuring And if you are in a relationship where you can be more self-accepting and accepting of your partner, and she has become more accepting of herself, right? The depth of the connection, the ability to be yourself, the depth of the acceptance has gone up. And so there can be more richness. And that's what it sounds like to me. I mean, I'm sure you're not that old of a person, but it could even be that your body is naturally just moving into a little less pressure, just as maybe testosterone levels are dropping a little bit or you're aging a little bit. And it can open up for other possibilities, more depth, more eros, more ravishment, more intimacy in the relationship. I think it can also be true, and I'm not saying this based on research, but just more my experience of working with people, where sometimes the drive and the hunger um, of a higher desire person is driven more by anxiety than desire. And that is, I want you to want me. I want to feel accepted in this way. This is the way that I know that I'm loved. This is the way that I release stress. So it's kind of driven in a more punctuated way, but more out of anxiety and immaturity. And as we get older and we settle into our relationship more and we trust the intimacy there and we trust that we're chosen, like some of the extreme of it settles a bit. And so I have watched as men and women get clear that they choose each other, that the high desire, low desire dynamic just softens. And there's just more um, comfort in being together, more ease, more freedom, not so much anxiety and management around those differences. And so that sounds a little bit like what you're describing also, and it probably is a little bit of both in the case of the person asking the question. So this person writes, why do I all of a sudden desire my wife less when she does a 180 and starts showing interest in me? I was, it was really off for me, like something was being hijacked from me. Like, wait, that was my role to pursue you physically. Why are you doing it now? It threw me way off when it happened and created problems when I didn't receive it well from her. Okay. This is not unusual where, when one person shifts, it just throws off the whole dynamic. And the person who thought they were completely anxiety free around sex or issue free around sex suddenly is showing issues in a way that can be confusing. So, there is no one answer on this, and I'll just give you some of the possibilities to consider. But again, you want to really look at what is the meaning? What meaning am I making of this? Um, Dr. Schnarch would sometimes talk about that in his experience, he saw this as like men who could not handle a woman that wasn't just sliding under them. That they didn't really want an equal partner. They wanted somebody that was there to be in response to them, someone to prop them up, and to see her as a sexual being in her own right, as an autonomous person, could feel threatening and therefore anti-erotic. And so that is one possibility, right? Like if you're seeing her getting stronger, if that's what it is, and that feels threatening to you, then and you need to see yourself in a particular way, or it's a rigid way, that can be a factor. Uh, but I do think there's more possibilities than that one, although I have seen that one for sure. The second is just, it's somewhat similar, but there is just a masculine feminine dynamic, I think, that's often in good sex. It's that chase, it's the pursuit, right? And women also like to be chased, right? Like there is a certain amount of that that's even happening in many secure, happy marriages where there's, like I notice you, I see you, I want you. That's the masculine towards the feminine. And that's part of the erotic dance, right? So sometimes if it gets changed, if it gets thrown in the other direction, it can feel like, hey, Like, why are you leading the dance? I'm the one who's supposed to lead the dance. Okay. And I don't mean it's because, oh, I need you to be weak, because in a good erotic dance, those are two equals. They're just playing out different parts of that erotic dance, or that seductive dance. So it could just be like it's throwing you off, but again, it depends. Like, is she just indicating that she likes it and that she wants you there? Um, because you can be doing the pursuing, the masculine pursuing thing, but it's also because you're tracking she wants you to do it. You're tracking that she likes this. You're tracking that she's desiring. For those who've taken the men's course, Art of Loving, and I talk about the two dogs, my two dogs playing with each other. One was taking a yin and one's taking a yang position. One's taking the masculine, one taking the feminine in their rough and tumble play. But they both want to be there. So one's all about surrender and helplessness, so to speak, in the play. But it's not about any difference in capacity or desire. They both want to be playing this game. So is it just something about what your erotic pattern is, and it's just throwing something off if she's doing a lot of the pursuit? Now, if she's just showing interest and she wants you to seduce her and you're just having a hard time now, then it's probably more something to the effect of, that pursuer distancer dynamic that a lot of theorists have written about. A lot of times people desire people they can't have, they can't get. Um, but both the pursuer and the distancer are usually intimacy avoidant. And so that is to say, like I had a friend who was, this guy really, really liked her. This was way back when we were single, really, really liked her, and she wasn't interested. And then he stopped being interested, and then she became obsessively interested. And um, and then, she started dating another guy who she really liked. He didn't like her. He didn't like her. She was pursuing. And then he started to be interested. And then she immediately was in like, no, there's all these things that I don't like about him. Right. I would say those are both, that's an intimacy avoidant person. So it's easy to pursue somebody who always has their back towards you, because you have this idea like, if I can get them to love me, everything will be well. But you don't have to actually be that exposed when you're in constant pursuit of somebody who's always rejecting you. When they then turn back towards you, a lot of people are like, oh, wait a minute, like, you're accepting my offer? I didn't know, I don't know if I want this. And that kind of Groucho Marx idea, like, you don't want to be a part of a club where they would accept you as a member. Like, if she likes me or wants me, like, what's wrong with her, on some level? And I don't mean to say that one's thinking that consciously so much as just moving into rejection to avoid the intimacy of the connection. Um, yeah, similar. It's just this idea. Is it just, only being able to desire when you know it's your idea? But when you know someone else wants it, that somehow you can't keep track of your desire. This happens with women a lot, who are the lower desire people, is that they may be able to cultivate desire, but when they can track that their spouse wants it, it just is so dominant in their head that they can't hold on to knowing that he wants something and get a hold of what they want, because they are too quickly infected by the desires of the other person, and therefore they feel controlled by it. It doesn't mean the other person's controlling. It's just that they can't differentiate enough and hold on to their own self-knowledge to sort out what they want when they know what their spouse wants. And so is it about that? Is it just that knowing she wants it, it just somehow you can't get a hold of what you want and you feel controlled by it? Is it distrust? Okay, so I think, in the series In Room for Two, that the series that's on right now, where Matt has always been the higher desire person, and then they separated as a couple, and now Liz's desire is up and she wants more closeness and so on. And Matt is like, I don't know what's the matter with me, but I don't feel desire. I think in that situation, it has more to do with a kind of distrust. And that is it just about you are just responding because you don't want the marriage to end? Or is it something that will stick? Is it really coming from something in you? Or is it just about trying to kind of, you know, throw me a bone, give me something that is not really about addressing the marriage. And so is it that? Is it distrust? Now, I think, you know, I think when something is genuinely shifting in your partner, and I don't think that's the situation with this questioner, I don't think that's a distrust issue based on how the question's asked. But if you are somebody who's in a marriage where you see your lower desire spouse getting a hold of something, well, you can see that it's not just they're showing up to enact sexual favors, okay? That is, they're growing into a stronger person. They are growing into somebody who's really choosing you, and you can feel the energy, you can feel that difference. Now, a lot of times people that prefer being in the pursuer position and get anxious when they see their spouse respond, they may go into a false critique. They may go into a too little too late because really they're afraid of intimacy, not because the other person's behavior is in fact untrustworthy. But those are two other possibilities. It's either it's just doing enough to kind of get me to re-engage and I don't want to re-engage, or that you again are afraid of your spouse's strength and you're afraid to actually receive them. Okay, I'm just gonna take this one. I don't know if I'm gonna have the answer or not because I haven't read the question before, but I'm the wife of a low desire man. I believe the low desire primarily stems from scrupulosity and sexual shame. I relate a lot to Matt in the Matt and Liz Room for Two series. Our counselor recently pointed out that my husband's low desire struggles really aren't personal. It would have happened no matter who he married. How can I work through the pain of not being desired and chosen in the past? How can I encourage my husband without making things worse by making it about me? Yeah, it's hard. I mean, yep. So I'll just say a few things about this. I think, again, our sexual selves flourish in a sense of freedom. And when we have grown up in meanings that pleasure is bad or unsafe, desire is bad or unsafe, that sexuality is evil or is going to hurt us, inherently, because of course, we can hurt with sexuality, and of course, it can make us unsafe. But if we sort of assume that it is just unsafe, right, then we're up against um, a real impasse in the sense that what I mean is, am I wanting to challenge the meanings that I've received in order to experience a richer form, a richer way of being human, to create a richer relationship? Do I want to deal with my anxieties and fears around this? And like the last Facebook Live where I talked more about trauma, the person that's in that position really has a decision to make. Do I want to push myself on things that scare me or that are difficult for me? There's people that have OCD, and the treatment for, for most versions of OCD is basically going and doing things that create anxiety in you. If you have stress about, I'm just trying to think of tornadoes, okay? Or tornado drills. I remember listening to a little girl on NPR, and she was talking about she had this fear of being in a tornado. And so she would look at pictures of tornadoes, and then she would listen, she would see, people running from a tornado, and then she would hear just the sound of a tornado alarm and things like that. And she would be super stressed, but it's like, it's basically when you're expanding the ways you feel hemmed in, what you're doing is you're going towards the things in a stepwise fashion that stress you out, and stress you out to like the level of a 7. I know that's very subjective, but they're not so overwhelming that you're out of your mind, and they're not under challenging. You have to breathe it down, but you can breathe it down. And that's how you deal with any fear that you have, including of scrupulosity, which is a version of OCD. You can't really make your spouse do it. You just can be honest about its impact and what it is that you want. And then you can, if your spouse chooses to challenge some of this fear, then you can work with the therapist around how you can basically work together around this. It's very similar to some of the trauma therapy approaches around sex, is like, how do we work together to find a way that we can be connected and not let the fear overwhelm us, or the, or the regression get in the way of the level of intimacy. So, how can I work through the pain? I mean, it is painful, and I think that not being able to be chosen sexually, not having someone who can or will do it, is really hard. And I don't think it's making it worse by making it about you. I don't think it doesn't have to be like, hey, it's all about me and I don't care about the fact that this is really hard for you. I do care that it's hard for you. And it's also very painful for me because I love you, because I don't want to leave, because I want to be with you. And yet it's very painful for me to give up an aspect of our relationship that I very much want to have with you. And that's not making it all about you, but it's giving the pressure that's inherent to a relationship by being honest. I mean, marriages pressure us to grow up. Now, most of us, are good at ignoring the messages around our immaturities, or trying to make it the other person's problem, how we impact them, or just ignore, not dealing with things. We can all do that, of course. But if we're staying honest in a marriage, it is going to pressure us because our limitations have an effect on the person we're married to. And um, so I think it's more than fair to be honest about your experience, knowing that he really does have a choice, of course, of whether or not he'll deal with it. And you have a choice about what you will do if he doesn't. Okay. All right. This person writes, I'm the low desire person for emotional talk and connection. I can do it here and there a few times a week, and I enjoy it. But my wife is craving this super badly, like a few hours a day and all through the weekend. But why do I get so averse when my wife is into me that much? And I don't want to be engaged in the same amount of being, and I don't want to be engaged in the same amount of being a gazer and a feeler throughout the week. When we were dating, this is what I wanted. It's like now I'm a grown up and I want my independence and my freedom more. I don't want to be enmeshed and codependent again, which then turns into a low desire on the sexual side when it's happening. Yeah. No, okay, that makes sense to me. So, I don't have your wife's perspective on this. So I don't know if I would see it differently if I saw how she experiences you during the week. But it does sound like it's a level of neediness that you're trying to resist because you want to feel free to belong to yourself. And if you're feeling like you need to caretake her, this is going maybe to what I talked about right in the beginning. If you feel like you need to take care of her emotions a lot and you need to, um, you know, make her happy and make her okay, it's going to make it easy to not eroticize her, or to not want to not feel free when you're with her. And again, our sexual selves like to feel free. So if you're feeling kind of entrapped by her neediness, that's going to drive some resistance. Now, that's very different than and this is sometimes hard to explain to people, because it's one thing to need and be needed. It's one thing to feel like I need to say things to help you feel loved, or to help you feel okay, or you want me to be looking into your eyes a lot, versus I really do love you and I care about you. So let me just kind of play the other side of this. I think sometimes, I'm not sure that this is the case here though. So, but I would say, a lot of times when women feel underattended to and don't feel noticed or cared about, they can get more needy or critical, or kind of pressuring for some acknowledgement that you see me, that you recognize me, that you know me. And that's not what I'm hearing in this question. But if it's about that, like sometimes people feel controlled just because they married somebody who wants things from them. And they just want to basically be married, but do it on their own terms. I worked with a couple where he took, like, he wanted to be married, he wanted to have sex, but he didn't want to have to do anything that she really asked of him because it would make him feel controlled and he resented feeling controlled. But, my point to him was then you probably shouldn't have gotten married. Okay. Because when you get married and you bring people into your life, well, they're going to have expectations and hopes and wishes, and they're going to want things from you. It's just a part of relationships. And if you turn that into, I'm no longer can be free, or you're controlling me, you're going to have a hard time. You're going to punish, you're not going to feel desire. Uh, Part of maturation, and again, I'm not sure that's what's going on in this person's question, but part of maturation is being able to really care about another person. Hold them in your heart. Think about how they are. Ask them about how their day is. Care about it. Make room for them. Make accommodations for them. And still be true to yourself. That is the goal. That is what differentiation is being able to be true to yourself and invested in your partner's happiness, which is different than gazing into their eyes all the time, looking at them, they're in a healthy marriage, there's often a really healthy amount of autonomy. And both people can handle that autonomy without it disrupting the sense of friendship and the sense that we are friends and we are partners and we really care about each other and we'll prioritize each other. But we can also go and do the things that matter to us individually. That's really what's at the core of a happy relationship and also a good sexual relationship. I'm speaking in very broad terms, but it's that sense that I don't feel entrapped by the sexual relationship. I don't feel entrapped by the marriage. Yeah, I've sometimes worked with people where I can tell they're monitoring their, or I've even had friends like this where you can tell they're monitoring their husband's reactivity. Like they feel like they've got to like do things to manage how he feels, even if we're all out at dinner or something. And that person feels trapped by the marriage because she's managing his feelings all the time. And of course, this can go in both directions. And so in a good marriage, you don't feel that you have to caretake, but you also are invested in their well-being and you care about them. And some people are like, what's the difference? Those are like the same thing. One is more about managing the happiness of the other person and you feel like you've got to take care of them almost like a parent. The other one is like, we are friends and I care about you and I'm willing to do things that are in your interest, but it's not out of anxiety, fear, and trying to manage something that's not yours to manage. This person says, as a higher desire wife, how do I not take my husband's low desire so personally? It's a meaning I'm making, but it feels like rejection. How do I hold on to myself? Well, yeah. So I think in some ways it's better understanding it. Like, um, what is at the core of the low desire? I mean, I think there's a double standard in some ways around this, but there is some biology to the double standard between men and women and differences in desire. So it's not, in my opinion, just cultural when we react to a husband's lower desire, because women's erotic pattern tends to be around, I want to know that I'm desired. And so it can be really painful to feel like men are supposed to desire and my husband does not desire me. So what is the matter with me? And it's a very, very easy place to go. But I think the more that we can understand it, the more you can at least see who they are from their own experience. What does desire mean for my husband? What is it that makes him less likely? How does he experience me? Um, and is there any part that I can play in making it better? Um, I think if you may have nothing to do with this, but if your spouse feels like he's got a job to do with you, right? He's got something he has to prove or solve or take care of. It might make him less likely to be there. Now, this may be 100% within him, but the more you can understand what is happening in the dynamic, I think the more you can either do something to address it or at least allow it to be not about you. I'm not saying these things are easy, because I think in marriage we all want to be loved, but we all want to be desired. And so this is just painful for people often that are the higher desire person, whether female or male, is to just, if you feel like this person just doesn't really choose me, doesn't really like me, doesn't really want this closeness with me, that is a hard thing. It is a rejection that can be hard to not just kind of fall into. And so I don't think the goal is to not care about it or to say it doesn't hurt, but more, is there a way for me to understand it and hold on to my dignity and hold on to who I am, and live in a way that I can accept and feel good about. And sometimes it's just to be honest in the marriage. Like, this is really hard for me. Not punitive, not cruel, but I really want something better. And to, to stand up in a sense for what it is you desire. And I would say that to men who are high desire and women who are high desire. Okay, this person says, my husband's not into me during sexual activities. He won't stimulate me the way I have asked him to. And we have talked about, okay, is this low desire or something else? It feels like something else to me. So what I would say is this feels more like passive aggression. I may be wrong, because it's just what I'm reading into that. He won't stimulate me the way I have asked him to and that we've talked about. It feels like maybe again, I'm not saying this is just what the wife is doing and the husband's just an innocent participant in this problem, because these are usually dynamics that each are contributing to. But it sounds like he's resisting, that he maybe feels controlled. I'm not saying it's right, but he feels controlled or micromanaged, or he doesn't want to feel controlled. And so he is resisting giving you what you want. And that can often be a part of low desire in men. There's a passive aggression in it, there is a resistance in it, and these can be co-created dynamics. But what often happens is then the woman in that will feel critical, because it's like, wait, why can't you do what we talked about? Why aren't you doing that? And then he can feel the critique, and then it makes him feel even less desire to want to give. And then she feels even more critical and more rejected and lonely, which can make her kind of handle that through a critique, whether internal or external. And that often creates this painful dynamic that's hard to break. And this is what can be really hard about couples issues, is oftentimes, and it's really what the ESI course, the Enhancing Sexual Intimacy course, is trying to help people with, is how do we each participate in our half of this dynamic? Because as one spouse does one thing, just like we were talking about around erectile dysfunction, I'm really worried I'm not going to have an erection and I don't want to be a disappointment. And then she's like, oh my gosh, he's not having an erection. That must mean he's not attracted to me. And then he's like, oh my gosh, that means he can track that she's upset, which gets him more distressed, which makes the erection really not happen. And then she really feels, and so then they're like, oh my gosh, do we even try that again? I don't even want to have sex next time because I don't want to be a disappointment. And now she's super convinced he's not attracted. You know what I mean? And so it's created a meaning dynamic that's stable and miserable, but they're hard to break sometimes because they're created by two regressed minds. And so you have to sort of see, like, how are we each participating in this, and are we each willing to kind of push ourselves to not fall into that meaning? That's really what the Enhancing Sexual Intimacy course is helping people with, is how do you find what your particular negative dynamic is when desire is low, or the openness in the marriage is low, and how do we each work with ourselves within that. Okay, I have no idea if this is going to be something I can answer now because it's just long, but let me just see if I can get some of it. I'm a formerly high desire person turned low desire. There was a mental switch from I'm excited to be in the relationship and I want sex to I no longer care if she wants it, I'll participate. No, I'm sorry, to I no longer care. If she wants it, I'll participate. Otherwise, I'm done and I'll take care of myself. I've had counseling for a few issues around failures, lost jobs, and for grief. I've taken all the JFF courses and trying to help the relationship. For her side, she shut down with grief after her dad died 18 years ago and still hasn't recovered despite years of therapy with various therapists. That's still the struggle in everything that touches her life, including our relationship, is grief. It sounds like, okay. I know you've said that if there was once a spark, it's possible to rekindle it, but if there never was, it's a different conversation. I still want to have the relationship and don't want to go elsewhere, but I've lost interest in what's on the menu. What are some ways I can encourage the flame or restart the erotic dance? Okay, let me just think about that. Um, there's just so much there that I don't know how to really answer it because it depends a lot on what's actually happening in this marriage, and it's not clear to me. Um, it sounds like you're angry on some level, and kind of the I no longer care. Um, it's just like kind of I'm giving up, and that just to me speaks to. I'm not saying that there isn't some legitimacy to this emotion, but then there's resentment and some passive aggression and just kind of screw you. I'm just like not going to try. That of course is going to um, kill erotic desire because you're basically, anger, resentment kills erotic desire. She seems to be grieving her dad and other things. What I would also say is you also probably, you have gotten counseling around failures, lost jobs, grief. You may also have on your side just some sense of futility and anger about that futility. And so it's easier to be in a kind of victim resentment than exposed. Um, you're speaking to the ways that she's been a problem, her grief. I'm not sure what else, but you're saying like, I don't want what's on the menu. I mean, it sounds like you're not sure that you can or want to choose your wife. I would say the if you really want something there, it's going to mean having more honest conversations and tolerating a sense of failure in some ways, but with more courage. It means looking at I would say looking at some of your passive aggression and your resentment as a coping strategy and how that's affected the eros energy in the marriage and how it's affected who you are as a partner, how you're a part of her grief, how you're a part of her low desire. um, those are just important starting places. And if you want to dare to step into your life with more vulnerability, because I'm certain that's what is going to be needed, at least on your side. I'm sure there are elements on her side, of course, but it would mean you stepping back out of your entrenched position to rekindle the possibility of opening up again and dealing more honestly with each other. Okay, everybody, that is
Jennifer,
it.
just
Yeah.
one quick thing. I just wonder if you could say, so for a lower desire man, would you recommend that they take the Art of Loving course, or do you think that they should take
Oh,
Art of Desire? How should they approach the courses from that angle?
I would say take the men's course, really. I mean, I think, what I was thinking? I was thinking we should just put an addendum session in there around low desire in men. I mean, it's in there a little bit, but I think it could just use more. I still just think it's the right foundational course for men. And yeah, we should just add that in there. I think it's better than the Art of Desire because the Art of Desire is much more around women's experience and of being female and so on. There's elements of the Art of Desire that's about low desire, but I don't know. I don't think that that's the right course for, I don't know. Maybe other people would disagree with me who've taken both courses, but I think I would recommend the men's course.
And ESI as well.
Yeah, ESI for sure. For
Okay,
sure.
great. I
Yeah,
just get that question a lot, so I like to have
sure.
you
Yeah, yeah,
answer it.
definitely. Yeah, definitely. Yeah, okay. Good, everybody. Hope you have a really good Christmas and I will talk to you in January.